Professor Bird, patho class. I know you won't understand. I did this all for you.
Oh my gosh, are you alright? Oh my gosh, you're coughing up blood. Someone call 911.
Hi, Mr. White. I'm Annie. I'll be your nurse today. How are you doing today?
I'm a little worried.
Really? What are you worried about?
What's going on?
Okay, well, I heard you had a little coughing episode the other day. Yeah? Okay. Well, we're going to do some diagnostics. You're going to get an MRI, a CT, you're going to get a chest x-ray, and also a lung biopsy, and then we're going to do some other labs.
Mr. White, Dr. Gray again. I have your results for you.
Yeah.
Were you done there? Have you ever heard of cancer? Yeah? Okay, well, cancer is an uncontrollable cell growth that can happen just about anywhere in your body.
I am a chemistry teacher. I know some of these things.
Okay, well, do you know what lung cancer is?
Do I have lung cancer?
You have lung cancer, Mr. White. Are you a smoker?
No, I've never smoked.
Never smoked?
Never smoked.
You must have really bad genes, sir. Well, so cancer, so basically it's a group of diseases that involves abnormal cell growth. It has the potential to invade just about any organ. It can grow and spread from organ to organ. There's 3 different cancer can be, excuse yourself. So cancer can be benign tumors or malignant tumors. Benign are non-invasive. They don't metastasize, meaning they don't spread to other parts of your body. Pretty confined and encapsulated.
I'm really shocked right now. Can I get like a handout or something? I want to talk to my wife.
Can I finish explaining your diagnostic to you first, sir? Okay. So can be benign or malignant, which is your case, which means that the cancer cells are rapidly growing and dividing. They're invasive and they're metastasizing. So you, sir, have lung cancer. You have non-small cell lung cancer, which is 85% of lung cancer cases. So, and there's 4 different stages. So the first stage is when cancer is confined to the one organ, so in your case, your lungs. Or it can be in stage 2, which means that it's in your lungs and in nearby lymph nodes.
Has it spread?
Yes, yours has started to spread. You, sir, are in stage 3 lung cancer, which means that the cancer is in your lungs and the lymph nodes surrounding your chest, especially like the center of your chest.
Oh, no.
Yeah, but good news is that you're not stage 4 yet, which means it hasn't spread to other organs such as like your liver.
How's my family going to pay for this?
We have people you can talk to about that.
Yeah.
Okay.
I'll figure it out.
Yeah, I will have someone come in and talk with you about payment options and support groups and all of that. So, do you know any risk factors for lung cancer?
I assume smoking and
I'm having a hard time believing that you've never smoked with the sound of that cough there. How long has that been going on?
just a couple months.
Couple months. Productive, non-productive?
It's been pretty dry.
You sound pretty hoarse.
Yeah, it's pretty bad.
Typical signs of lung cancer include hoarseness of breath, productive or non-productive cough that doesn't go away.
It's been really bad.
Have you had any unexplainable weight loss?
No.
No. Fatigue, pain, recurrent?
I've been really tired, but those high school kids are just kind of running out of the day.
Yeah. Kids. All right. Well, normally cancer has a lot of treatment options. We could try chemotherapy, which includes a bunch of chemical substances, including anti-cancer drugs.
I'm good with chemical substances. Yeah.
Oh, okay, well, we're going to do our chemical substances, sir. Okay. So the
I swear.
anti-cancer drugs are usually effective at curing cancer or prolonging life expectancy or even at reducing cancer symptoms. Another option would be radiation, which could be with beams or seeds that we implant into the affected organ to stop cell growth and division, and that can alter the DNA synthesis and cause cellular death.
Okay.
There's also the surgical route, in which we could remove tumors if applicable.
You're gonna take my whole lung out?
Well, that's the thing, sir. With your case, there's no treatment. You have about a year or two to live. So, I actually have
That's-
to go. I have
I-
margarita time
I
and
have
then like
quite-
tea time. So, if you need something, just to let someone else know.
Too good at explaining. Dr. Gray, something going on with her. She wasn't too good at explaining what was happening.
Yeah, her husband, Dr. Shepard, just died, and we're all trying to cope,
Oh.
and we're all grieving.
That's really sad.
Yeah, it is really,
Oh, okay.
it's a sad thing.
I
Let's not
understand.
talk about it.
Okay.
So, do you have any questions about your diagnosis?
How did it spread so? Sorry.
Do you need tissue?
I-
No? Okay. Well, let me explain. I have a handout for you. We'll take a look.
Oh,
All right.
I didn't get to read that. Oh, okay.
Oh, don't worry, you have a copy. Okay, so how it's spread is the process of metastasis. So what happens is your cell starts to transform, as you can see right here. And then it goes through angiogenesis, which means that their own blood cells and blood vessels start to form. And then it starts to mobilize and invade the capillaries, lymphatic vessels. Then it comes down and it embolizes and starts to circulate throughout your system. And after that, it transports to the lungs. And then it'll adhere to different capillary beds. Mr. White! That's in the capillary bed. It'll go into extravasation to the organ parenchyma, which is the functional unit of each organ. So in your case, it would be the lungs. And then it'll have a response to the microenvironment with your lungs. And then you'll have your tumor cell proliferation and angiogenesis. So those cells will start to form their own blood vessels and it will start to grow from there. And here, this is kind of like what your lungs are starting to look like. And then, yeah, that's pretty much it. Do you have any questions?
I kind of get it now.
You kind of get it?
Yeah. that's
Okay, so
really,
tell me what I
really
just
sad.
said.
So the cells will transform, and then they're gonna make their own blood supply.
Yeah.
And then they'll move into my bloodstream, and then they'll move to another organ, and then they kind of form there.
Right.
Okay.
Okay.
Yeah. That's So this has already happened before I even noticed. And
Yeah.
is that what is that what that's from?
Yes. Yes. Teach back method. Sorry. I'm sorry about that.
It's okay. I
It's
understand.
been a struggle here at the hospital.
Okay.
Lost one of the best doctors ever. So, okay, well, do you have any questions about any coping?
No, it's been hard. But we're coping, you know. Not like it's better than making meth or anything, you know. It costs a lot of money, but we'll figure it out. I have a plan.
Right, so you're not making meth, so you're coping healthy, right?
Yeah.
Shout to all my boss boys, we rowdy. Shout to all my boss boys. Shout to all my boss boys, we rowdy. Shout to all my boss boys. Shout to all my boss boys. Bang around bass. Bang around.
Okay, well, if you need help with coping in a healthy way, we have different hospital coping support groups here for cancer.
Welcome to CVS.
Hi, I'm Mr. White.
All right, Mr. White, let's take a look at your prescription and see what you've got today,
Okay.
So the first thing, what you're going to start with every day, you're going to start with your granisetron, which is Kitril, which is an antiemetic. So you're going to take that 1 hour before you do your chemotherapy drugs. Okay.
What's an antiemetic?
I'm getting there. It's going to help you with your nausea. So to prevent your nauseous feeling when you take your meds, because your meds are going to make you feel pretty nasty. So this will help with your nausea. And if that doesn't help, if it's not cutting it enough for you, you let us know and we have some stronger. Okay? So you'll do that an hour before you do your chemo. So then 30 minutes before you do your chemo, you're going to take diphenhydramine, which is also known as Benadryl, which I'm sure you're familiar with. So 30 minutes before you do your chemo, you're going to do this, and this is going to help you with any kind of sensitivity reaction you may have to the chemo. It'll also help with the nausea. It has a slight antiemetic property for chemo. It also will, it's a slight sedative, so it'll just help you be a little bit calmer when you're going through your chemo.
These look like meds for a dog.
Yeah, that was the only bottle we had left. So then next you're going to do your dexamethasone, which is also referred to as Decadron. This is a steroid. It's an anti-inflammatory, and you're going to take this one 15 to 30 minutes before you take your chemo drugs, and that is going to help with the anti-inflammatory. It's going to serve as an anti-inflammatory, and it's going to help your body process the chemo and help prevent any flare-ups and prevent pain.
Am I going to get a handout for any of this stuff? This is a lot of stuff.
You'll have to talk to your doctor. So next we have your first chemo drug. This is an actual chemo drug. Is crizotinib, which is also called Zocori, and this is an anti-neoplastic, which just means that it's a cancer drug. And this particular one is a kinase inhibitor, and it's it's used primarily for non-small cell lung cancer, which is what you have. And it's they tested your markers for what your particular cancer is going to do, and this is the drug that's going to stop the growth of those tumors.
Okay.
So that one. So your last chemo drug is called, just let me finish please, erlotinib, which is also called Tarceva, I'm not even sure. It's also an anti-neoplastic, but this one blocks growth stimulation, so it's going to prevent the tumor from growing. It blocks in a different way. And this is also another one where they tested the markers of your tumor and they know exactly what it's doing, and that's what this drug is for.
This is a lot of stuff.
So this one you want to take 1 hour before a meal or at least 2 hours after. So you'll need to schedule your day around when you take these meds.
Okay.
And like I said, if your anti-nausea med isn't working, we can give you something stronger. Okay, so be sure and schedule those all exactly the right time so that it doesn't make you sicker.
Okay.
And now I need $10,000.
Okay. I have that. Don't ask me how I got it. I have it.
I'm not asking any questions as long as I get paid.
Okay. Where is it? Can you leave for a second so I can look for it?
All right.
Pamphlet. Jason. Oh! Is this the Heisenberg? Just come back. Come back later.
I've been married a long time ago. Where did you come from? Where did you go? Where did you come from, Cotton Eye Joe? I've been Cotton Eye Joe.
I think you're cute, but really you should know. I just came to say hello.
Don't do drugs, kids.
As I walk through the valley of the shadow of death, I take a look at my life and realize there's nothing left. Cause I've been blasting and laughing so long that even my mama thinks that my mind is gone. But I ain't never crossed a man that didn't deserve it. Me be treated like a punk, you know that's unheard of. You better watch how you're talking and where you're walking, or you and your homies might be lined in chalk. I really hate the trip, but